Here we are today in Victorville, California, and we're delighted to have our guest as Dr. Siva Arunasalam, who is the director, founder of the High Desert Heart Institute in Victorville, California. And Dr. Siva, we're so delighted to meet with you today. Would you just share with our audience your credentials as a cardiologist and your background and educational pedigree?
I came to this country in 77 actually. I went to undergraduate in University of Nebraska, and then I did my MD PhD, started in Johns Hopkins, and then I transferred to Emory University in Atlanta, where I did my MD PhD program, and then I did my residency training and my fellowship at UCLA and Cedars-Sinai Medical Center.
Cedars-Sinai, that's obviously extremely distinguished.
Yes, it is.
And based upon that, so you're board-certified cardiologist as well as internist, is that accurate?
That's correct. I have board certification in internal medicine, cardiology, and interventional cardiology as well.
What led you or motivated you to start your own clinic or institute primarily dealing with cardiovascular care of the kind of quality and substance we've seen at the High Desert Institute?
In 1995, when I was finishing up my fellowship at Cedars, one of the local hospitals here was looking for an interventional cardiologist. So they came and invited me to set up a practice here, and I looked at the surrounding areas. There was a tremendous shortage for qualified cardiologists in the area, and that's how it began. So we started off as a single two-room office right across the street from the hospital. And then within the last 10 years, we have grown to 5 cardiologists and a 20,000 square foot facility. And what we have found is the chronicity of illness is getting worse. We are seeing less and less people with heart attacks, but we are seeing more and more people with chronic illness of congestive heart failure, patients who are having continuous symptoms of chest pain. Because we are saving those patients who used to have heart attacks, we're able to intervene and save them. But now we are ending up with problems where the heart muscle is weakened because of the damage that has been done. 20 years ago, those patients would not have lived, but with modern medication, we are able to keep them alive. And now we are reaching the next stage. The stage is we've already maximized the medical management. So what do we do next for our patients? Patients who are in their 80s, their brain is still functioning, they want to be active, but they are limited by their cardiac condition or their medical condition. And so we were looking for alternatives. In 1999, when I was sitting for my interventional boards, at that time I was reading a bunch of articles, and I came across articles on L-arginine. And I said, wait a minute, this is a drug that converts into nitric oxide, and that is the drug that we give as sublingual nitroglycerin that also converts into nitric oxide. What a novel idea, where you do not have so-called tachyphylaxis or tolerance to the drug, but now we can give this nutritional supplement in very high quantities and high frequency that will mimic nitroglycerin without all the side effects. And since 1999, we've been using L-arginine in our practice.
It seems from my experience in the last couple of years that many cardiologists have not kept up with this kind of research. What is your response to why there seems to be a lack of cutting-edge information on the arginine therapy that's available among that of your profession?
How many drug reps do you think comes to our office selling L-arginine? Nobody does, because it is a generic product. So all we hear from our literature is lowering cholesterol, use nitroglycerin. That's what we've been sold. And as a medical profession, to be convinced and to say, all right, you know, nutritional supplements can also play a role, sometimes we feel it is demeaning to us. But at the same token, look at how many years it took for us cardiologists and internists and family practitioners to be convinced that cholesterol lowering is good for you. It took 25 years because it took that long for us to be convinced, most of us. Even now there is reluctance in how aggressive we need to be. So it's not unexpected. It is not unusual when a product like L-arginine, which nobody promotes, it is there in the literature, but nobody is taking the step. Unless there is money to be made, nobody's going to promote it. And now there is people taking the first step to promoting a nutritional supplement that is going to be
Now,
beneficial.
I understand that your specialty, or one of the things that you have contributed greatly to the field of medicine, is in the specialization in certain types of stents. Could you tell us a little bit about that?
We do a lot of angioplasty. Last year alone, we did about 450 angioplasties in our practice. We do drug-eluting stents. We do bare metal stents. What are drug-eluting stents? Stents that we put in to open up the arteries have medication that prevent the arteries from collapsing. We don't mean by physical collapsing. We mean by whenever we injure something, scar tissue forms, and that is the same thing within the artery itself. When we go open it up with a balloon, scar tissue, it is a scarring. It's an injury that we are creating, and the body reacts to that injury by forming smooth muscle cells. It starts to proliferate. The newer stents have drugs in them that prevent that proliferation from taking place.
When you started putting the patients on your study with the ProArgi-9 Plus, what kinds of results did you anticipate, and what ended up happening after the 90 and 180 days that gave you such an astonishing report?
We actually expected everything to happen. That's one of the reasons why we did not have a dose curve. That means, you know, in 1999 when I started using L-arginine, I was just using it whatever I pleased, the dosing we wanted to give. We did not give high enough doses. I knew what L-arginine will do. We knew it will lower the blood pressure. We knew what lower blood pressure means to our kidney function, to our heart function. So we knew what the product in high enough concentration can achieve. But some of the stuff that we noticed was remarkable. And in short time, not the time that we expected. Say, for example, if I were to give a patient medication for high blood pressure, we will lower the blood pressure, but the results of lowering the blood pressure would take years to see. But this product, on the other hand, we saw lowering the blood pressure through this medication, other side effects, beneficial side effects that were immediate. Within a month, we started seeing tremendous benefit, which was unexpected.
Did you find that one of the things we hear often is that people should be concerned if they're on Coumadin or Plavix about the fact that ProArgi-9 Plus has a small amount of vitamin K? How do you respond to that?
Vitamin K is never an issue when you're anticoagulating patients. As long as they're taking a product on a consistent basis, then we can adjust the medication easily. And I always hear patients who are on Coumadin not to take any salad and green vegetables. And as a cardiologist, that is just opposite to what we are taught. We are told we need to eat vegetables and broccoli because that's good for you. So what we tell our patients, we don't tell them to avoid the product. We said moderation. You don't go eat a head of lettuce, but as long as you're introducing, green vegetables on a daily amount, then we will adjust the Coumadin accordingly. Same thing with any product that contains vitamin K. As long as we know the amount of vitamin K you're receiving is constant, then adjusting Coumadin is going to be easy. It's not going to be a big issue.
So you didn't have any concern at all putting these chronically ill cardiovascular patients from your clinic on 4 scoops of ProArgi-9 with the resulting vitamin K as one of the ingredients, even though many of them or all of them were on Coumadin or Plavix?
But not all of them. A small percentage of them are on Coumadin, on Plavix. No, we did not have any issues with that.
And from a preventative standpoint, when you talk about the stents and the bypasses, even though that's been a very enormous part of your business, do you see any conflict or problem with having that being reduced if people can be improved with having their arteries be perhaps clearing with the use of a product like this?
No, that's what I'm in the business of cardiology, not to do stents. I'd rather not be in the cath lab at all. I'd rather spend my time in the office and taking care of patients. For me, taking a patient to the cath lab and doing a stent or sending a patient for bypass surgery is actually, if a patient has been with me for 5 years, it's a defeat. I'd rather not see the patient in the hospital or in the cath lab or being sent to the OR, which means then I've done my job.
It's music to our ears to hear that, Dr. Siva. We're so delighted that you took an enormous investment. Would you mind me asking, Synergy Worldwide did not come and induce you in any way financially to do this kind of a study. Didn't you take the initiative and essentially fund the study outside of the product for this?
Yeah, the only thing Synergy provided for the study was the product itself. Everything else we did it on our own. In terms of all the testing we did, what we wanted to do with the patients in terms of 6-minute walk test, the laboratory testing that we did, all the stress tests and the echocardiograms that we did, all that was done on our behalf, not on Synergy's behalf. Nobody compensated for it.
And that would have been hundreds of thousands of dollars worth of testing that you invested as a clinic to try to find answers that would help your future patients and your current patients.
That is correct.
Well, we admire that greatly, and we can't tell you how much we appreciate your foresight, your vision, and your commitment to wellness. Do you feel like this type of a breakthrough in this research and the testing that you've done, what can it do for the health care situation in our country?
It will greatly improve in the sense that we should not stop here. As an institute, we should not stop at just doing what we did. We need to take it to the next level. And we are planning the next series of studies that we want to do to see what we can do to our patients, for our patients, not just stop where we are. It's a first step, but a lot more we can do to actually promote this kind of nutritional supplements that will benefit our patients in the long run. We do not want to bring the patient in another 3 years and do another stent, or bring a patient in for another 6 months and do another stent. Remember, stenting does not prevent heart attacks. It only improves symptoms. My job is to prevent a heart attack. We want to prevent another procedure. So we will do what we need to do to fix the artery at that time, then be aggressive in risk reduction. And that's where ProArgi-9.
What about pulmonary hypertension? Did you see any improvement in the study on that?
We have a large population of pulmonary hypertension patients, and that is one of those benefits of using ProArgi-9.
That's exciting because it sounds like a lot of people went from using oxygen almost 24/7 to not needing that. Is that something that surprised you?
If it is truly pulmonary hypertension and we were to measure the pulmonary pressures pre and post treatment and they had significant improvement, then it was not surprising to see them no longer requiring oxygen.
Lastly, sometimes that people ask me, what impact does the dilation and the clearing of the capillaries and arteries have to do with renal failure or even other organ disease outside of the heart or cardiovascular disease? What kind of an observation do you think you can judge from your experience now over the last 6 months?
Think about it. Everything depends on blood flow. Blood flow governs whether you have a stroke or you don't have a stroke, whether you have normal liver function or not, whether you have normal kidney function or not. So as long as we improve blood flow, then all these organ systems will be healthier. So as we grow older, as the arteries become harder, they'll become less compliant. These are the reasons why kidney functions fail. If you look at a person who's 70 years old, their kidney function is half what it was when they were 30 years old. Why? It's because of cellular death contributed to a certain extent by lack of or inadequate blood flow. So if you're improving blood flow, then you're improving survival of this.
Did you find that neuropathy was one of the first things that seemed to be an improvement among the people that were in the study?
Not so much as neuropathy in terms of symptoms of pain, but in terms of improving their circulation. Remember, part of the reason why the legs develop neuropathy and neuropathic symptoms is because of lack of circulation. Peripheral vascular disease is one of those things that is very prevalent in our population, especially in our diabetic population, and goes along with it comes neuropathy because of lack of circulation, which is contributing. It's not all of it, but it contributes. So if you're improving microvascular circulation, then you're going to improve symptoms of neuropathy.
You've heard from Dr. Siva Arunasalam, and we're so grateful for his investment of time and energy and resources and that of his staff